Hi students, this is Dr. Srinivasan Patnam and today we will be discussing about hospital management and operations. So, this topic belongs to MBHCM first year, first semester, where the block 3 is the main topic, operations planning, IP services, unit 7, inpatient services. So, in this part 1 we will be discussing about the definition, functions and process of inpatient services. Definition. So, what is inpatient? We will discuss about inpatient department, the definition of inpatient and admission. So, inpatient definition is a patient who stays in a hospital to receive certain medical care or treatment overnight or more, and this usually is like for more than 24 hours, which is considered as a benchmark. So, why do we need to see this as 24 hours is because the patient has to be observed, treated, and the outcome has to be clear, so that the patient is fit for moving away from the hospital for the whatever the clinical ailments that the patient has come with. Okay. Now, what is the inpatient department? Inpatient is a department or a unit of a hospital where the patients can be located and treated for providing different services within the hospital, let it be a medical care and other services that we will be discussing further. So, these are the services where the patient receives in the inpatient department. Now, how does a patient becomes an inpatient? Okay. So, this patient coming to hospital from different sources. So, for example, patient comes to an outpatient department for a doctor consultation, doctor asks the patients to get admitted, the patient gets admitted into the hospital and becomes an inpatient, or the other sources, patient coming from emergency department for further care after being treated for the emergency condition, for further care and service, the patient is brought into the inpatient department, or patient is admitted as an inpatient. And other patient, other sources would be like patients coming from referral doctors, where the patients were analyzed by doctors in different clinics or different locations. They send the patient to the hospital to get further care, so that the patient is treated accordingly and discharged. So, this is inpatient. These are the different sources of inpatient. So, patient admission means allowing the patient to be in the hospital, stay in the hospital or unit or ward, whatever the department it is, for different kinds of services that the patient needs, let it be an observation, going for an investigations or treatment of various kinds of diseases. Okay. Next, moving on to the what are the functions of the inpatient department. So, when you say we have a department within the hospital and the functions, so what are the main functions of that department? So, the core inpatient functions are providing clinical care to the patient, nursing care and different diagnostic services, treatment and observations. So, how are these services provided? So, they are like not each service is provided at a time. This can be a combination of all these services or a single service at a time. Okay. So, like for example, a patient gets admitted for a surgery. So, there the clinical care is required, nursing care is required, and different tests, that is diagnostic care services are required, and for whenever the patient undergoes a surgery, the treatment part is done, and after the surgery the patient is observed how the patient is improving after the surgery, and the analysis is done and consider that the patient is fit for discharge. So, these are all a combination of different services within the inpatient. So, how do this inpatient should be like when a patient is admitted? So, it has to have a hygienic environment for a patient stay. It has to provide that comfort stay to the patient, and the inpatient has to have the different arrangements, so that the patient and the patient caretakers, like the patient relatives or close family members or relatives, would take care of the patient within the inpatient department. And also this inpatient service department has to provide training and education. Training and education to whom? Training and education to patient about their health conditions, about their treatment plans, about their outcomes of the treatment plans, and also it is not only for the patient, but this department provides training and education to the staff who are working in the inpatient department, where the patients would be the staff would be trained on different kinds of services or care areas that they are working. They are trained up to work in those areas. They are provided education, upgrading their skills and knowledge to serve the patients within the inpatient department. Okay. Now, let us see the process flow, how a patient becomes an inpatient and then how the patient is moved out of the inpatient department. Okay. Now, the patient, like as I mentioned earlier, the patient comes from different sources of inpatient to comes to the hospital from different sources to become an inpatient. So, where the patient is admitted, once the patient is admitted, then only the patient is called as inpatient. Okay. The patient once admitted, he is sent to a particular location in the hospital, let it be a department, a single room, private room or different areas of the hospital where it is called designated as inpatient department. Then different services, as we discussed earlier, different services where the patient is kept and the patient undergoes those services like clinical care, nursing care and diagnostics, treatment and other, even you can consider in recently like rehabilitation services which are part of an inpatient, like alcoholic de-addiction or any therapies or rehabilitation exercise therapies, like for example, a broken limb of a patient where the patient gets admitted and undergoes different physiotherapy sessions to improve the mobility of the patient, right. And after undergoing chronic illnesses, the patient needs to gain that vitality. So, all these services, rehabilitation service to improve the life of the patient, also part of inpatient if they are existing in the hospital. So, once all these services are received by the patient, then the patient is analyzed for the stability, like whether the patient is fit to be discharged or not, whether the patient is fit to go home and get the healthy, go home in a healthy condition. Okay. So, the stability of the patient for discharge is ascertained. So, once this is decided, then the doctor checks the patient and writes a discharge orders, where the orders are written saying that okay, this patient can be discharged with this particular type of medication. So, whatever the medications that are there, the doctor prescribes, and these discharge medications are updated in the discharge summary, where the entire history of the patient, like right from the patient coming, what is the reason that the patient has come to the hospital, has got admitted into an inpatient service, what services have been received by the patient, let it be the nursing care, medical care, diagnostic services, all are being updated into the discharge summary, and the summary is finalized and signed by a doctor. So, once the summary is finalized, then the patient is billed for the services that the patient has received within the hospital. These bills can be a cash receipt or a credit type of category, where the patient pays accordingly by a cash or maybe a credit, like for example, an insurance, like again an individual or a corporate insurance. So, these are the different types of billing mechanisms that would be applicable for the patient. So, once the billing is done, the discharge summary and all the entire diagnostic reports that have been performed for the patient within the hospital are handed over to the patient, and then the patient is counseled related to the medication, related to the diet restrictions, and when the patient has to come back to the hospital for a follow-up, all these will be educated for the patient, and the patient is discharged home and the patient leaves the hospital to go back home, and the patient returns back to the hospital for a follow-up treatment, which might be outpatient department or again an inpatient, depending upon the planned care that is decided during the discharge. So, now this part of inpatient services part 1 is concluded, and thank you students for listening.